Today, I'm going to talk about getting a single tooth implant. What can you really expect if you decide to get dental implants? The success rate for implants is 98 to 99%, but it drops to 70% for those who make these mistakes in the first 4 weeks after the implant is placed, even though these mistakes are easy to avoid. Next, I'll tell you what to expect so you don't run into any unpleasant surprises. How you can save money, what the real benefits of implants are, and who absolutely should not get them. I'll start with what you need to be prepared for. In the first few hours after the implant is placed, you might notice a small amount of blood in your mouth. This isn't a complication. It's a normal reaction to the soft tissue being disturbed. It goes away on its own within a few hours, and that's completely normal. Sometimes the implant doesn't take. It doesn't happen often, but it does happen. An infection can develop if you don't take good care of your mouth. Smoking reduces the chance of the implant taking hold to as low as 77% because blood flow to the tissues gets worse, less oxygen reaches them, and as a result, the tissues heal more slowly. A lack of bone or an initially poorly placed implant also lowers the chances of the implant taking hold. If this happens, the doctor will figure out the cause and reinstall the implant, sometimes right away and sometimes only after a few months once the tissues have fully healed. An implant is not an instant ready-made tooth. Imagine you've planted a tree. Before it can grow strong, its roots need to firmly take hold in the soil. It's the same with an implant. First, it needs to take root and fuse with the bone. Only then can it handle pressure and have the crown placed on it. And this process takes anywhere from 3 months to half a year. The reason is that the bone needs to grow into the threads of the implant, just like tree roots grow into the ground. Until that happens, the implant is held in place only by the threads themselves. And if you put pressure on it too soon, like by chewing, it can loosen and fall out. That's why, for all those 3 to 6 months, you have to go without a tooth. If it's a front tooth, a special temporary crown is usually placed, but you absolutely must not chew with it either. Even the most expensive implant can be lost if you don't take care of it. Plaque builds up around an implant, just like it does around a natural tooth. If you don't remove it, gum inflammation starts, which gradually goes deeper and destroys the bone around the implant. And since an implant is an artificial tooth, you don't feel it like your own natural tooth, so it can be hard to tell if something is wrong with it, especially if you don't go for checkups and don't take good care of your teeth. Brushing twice a day and regular checkups aren't necessary because your dentist wants to make money off you, but because it truly determines whether your implant will last a lifetime or if it will have to be replaced. There will be swelling and possibly bruising. This is the normal reaction of the body, not a reason to worry. Usually, the swelling increases in the first few days and peaks on the 3rd day, then starts to go down. The more intense the swelling, especially the bruising, and the stronger the body reacts to the intervention during dental implantation, the better the healing will be. In general, during any surgery or injury, the body sends all its protective resources to the affected area so that healing happens faster and more effectively. A good bone callus forms, and the implant will be more secure. Give this a like if you didn't know that. Sometimes, before placing an implant, it's necessary to build up the bone. For example, if the tooth has been missing for a long time, the bone in that area may have shrunk due to lack of load. The body does this on purpose, so it doesn't waste resources on something that's not being used. In this case, an additional stage of treatment is added with its own timeline and cost. Usually, this is done right during the dental implant procedure. This takes about another 10 to 15 minutes. Now, I'll tell you what can help you save time and money on dental implants. If you have a tooth you want to replace with an implant, often, you don't have to wait for the socket to heal. You can have the implant placed the same day the tooth is removed. It may not always depend on the condition of the bone, but if possible, it saves you months of waiting. Be sure to ask your doctor about this. The cost of implants usually scares people because it seems like you have to pay everything all at once. For example, in our clinic, you can split the payment into 3 stages. First, you pay for the implant placement itself, which is about 45% of the total cost. Then, for the abutment, which is a connector between the crown and the implant that is placed 3 to 6 months later. That's another 10% of the total cost. And finally, you pay for the crown itself, the actual tooth. 2 weeks later, you pay the remaining 45%. This way, you pay gradually as each stage of treatment is completed, instead of paying one large sum all at once at the beginning. Be sure to ask your dental clinic if you can do it this way as well. The actual implant procedure doesn't take long. Usually it takes about 20 to 40 minutes, depending on your case. Most people don't feel any pain. The main thing is to bear with the injection in the gum, the anesthesia itself. During the procedure, you'll feel some pressure or just the sensation that something's being done. That's it, nothing more. There shouldn't be any pain. I think that might not reassure everyone. Let me know in the comments how anxious you are and how you deal with your fear. For most people, this isn't a story about spending weeks recovering at home. Many people go back to work the very next day after getting an implant, unless, of course, their job involves physical labor. Now, I've told you all the scariest things about dental implants that people often don't mention. But why is it still chosen as the main way to restore a tooth? The first reason is that the neighboring teeth remain untouched. In the past, if you were missing one tooth, there was only one option, a bridge. To do that, you had to grind down 2 perfectly healthy neighboring teeth to secure the structure. With an implant, you don't need to do that. It stands on its own and puts load on the bone exactly where it was placed. And the neighboring teeth stay intact. Second, implant survival rate. As I already mentioned, 98 to 99% is not a coincidence, but a statistic confirmed by years of observation. The result is truly predictable in the vast majority of cases, especially if you take care of your implants. Comfort. If you compare it to a removable little butterfly denture, the difference is huge. An implant is a fixed structure. You don't need to take anything out at night or worry that something will fall out at the wrong moment. And a removable denture for a single tooth is often uncomfortable to attach. It's noticeable on your teeth, and sometimes you can even swallow it while eating. Fourth, the bone in that area doesn't recede. Bone that doesn't get any load gradually decreases in volume over time. The body simply gets rid of what isn't being used. An implant restores chewing load to that area, and the bone starts working again. Fifth, implants come with a warranty and a passport with an individual serial number. This is an international standard. If you ever find yourself in another country and need help, any clinic can identify exactly what you have by that number. And the last point is speed and durability. The procedure itself takes less than an hour. And if you maintain good hygiene and visit your dentist for a checkup at least once a year, the implant can last you a lifetime. And finally, the most important thing, who absolutely should not get implants. First, uncontrolled diabetes, when medication can't keep your blood sugar in check. In this condition, tissues heal much worse, and the risk that the implant won't take increases significantly. Second, cancer. If the patient is under the care of an oncologist, during this period, the body directs all its resources to fighting the disease, not to healing the implant. Taking bisphosphonates, medications prescribed for osteoporosis and certain cancers, they have a serious impact on bone tissue and prevent it from properly recovering for healing. Fourth, immunodeficiency conditions. For example, HIV. A weakened immune system doesn't heal as well, and the risk of inflammation is higher. Fifth, being under 18 years old, and sometimes even under 21. Up to this age, the bone and jaw system is still developing, and any intervention could actually do harm. If any of these points apply to you, be sure to discuss them with your dentist during your consultation before making a decision. Subscribe to the channel, give us a like, take care of yourselves, and stay healthy.